Following program is sponsored by Community Psychiatric Centers and is produced for educational purposes only. It is not intended as a substitute for medical or psychological advice, diagnosis, or treatment. The content should not be used for self-diagnosis or treatment of any health-related condition. As always, seek the advice of your healthcare provider with any questions regarding a medical or mental health condition.
Welcome to Community Psychiatric Centers Presents. Tonight we're talking about the impact of trauma on children. It can be caused by many things, from natural disasters to witnessing violence to experiencing neglect or abuse. As a result, some children may experience post-traumatic stress disorder, a condition our experts can tell us all about. Dr. John Carasso is Clinical Director of Community Psychiatric Centers. He's a clinical licensed child psychologist and a certified school psychologist. And Dr. Robert Lowenstein is Medical Director of Community Psychiatric Centers. He's a board-certified child, adolescent, and adult psychiatrist and a fellow of the American Academy of Child and Adolescent Psychiatry. Good evening, gentlemen.
Good evening.
Dr. Lowenstein, there are so many different types of traumatic events, from hurricanes to house fires to death and divorce. How can these events impact on a child?
Well, first we should talk about what post-traumatic stress disorder is about. Post-traumatic stress disorder is an anxiety disorder, which is caused by a person's exposure to either a physical or mental trauma, which can include the violent death of somebody, exposure to abuse, as you mentioned, the natural and human-made disasters like bombings, earthquakes, floods, being involved in car accidents, plane accidents, being involved in combat, and also being exposed to all forms of abuse. Post-traumatic stress disorder occurs after a person is involved in one of these events or is exposed to it or experiences it secondhand. During the time that they are exposed to it or experience it, the person experiences intense feelings of fear, intense feelings of helplessness, and feelings of horror. In children, this can appear as being severe feelings of agitation and not knowing how to respond to those events. Now, following the exposure to a traumatic event, the individual will experience some symptoms which have to be present for at least a month for them to qualify for the diagnosis of PTSD. Those kinds of symptoms can include re-experiencing the event through intrusive thoughts or nightmares or memories which just come out of the blue, so to speak. And these are repetitive and recurrent. The person then avoids places, people, things to which they associate the event with and get very fearful and anxious should they be confronted by those people, places, and things, so they avoid them. The other thing that happens is that the person has what's called psychological numbness, which means they tend to be depersonalized. They tend to seem distant and not connected to people who they formerly were very attached to and loved. They seem sort of into their own world at times. And lastly, there's a thing called hyperarousal, which means the person can have startled types of reactions. They can be very jumpy. They can fear that things will happen to them, and it comes out of the blue. They get to be what's called hypervigilant, which means they scan the environment for those things to reoccur.
Does the type of trauma, Dr. Carasso, influence the impact that it's going to have on the child?
Good question. It can. It's important to note, though, that a traumatic event, by definition, is traumatic. And that may sound redundant, but it's an important point because we wouldn't want to make assumptions about how we think a child should be responding to any given trauma. However, having said that, we can at times assess the type of trauma to help get a sense of the seriousness of the incident at hand. For example, if a child experiences a trauma firsthand as opposed to witnessing it, the child who experiences it firsthand sometimes can have more of a pronounced traumatic reaction. Now, in terms of witnessing it, it can also make a difference as to whether they experience it or witness the trauma from afar or close up, as one would expect. A trauma experience that is close by tends to have more of a reaction than one from a distance. Also, comparing and making a distinction between traumatic events that occur as a part of an accident or natural disasters, such as a hurricane or car accident, as opposed to an incident that stems from a person's behavior, a perpetrator, for example. And especially if that person is a trusted caregiver, that tends to be especially traumatic for a child. And so again, we can use those barometers in terms of types of traumas to gauge the seriousness. But again, we don't want to make assumptions because every child responds differently, and there's always individual differences that we have to take into consideration.
Is there a difference in the way that a child shows signs of post-traumatic stress disorder versus the way an adolescent might show those same types of signs?
Yes, absolutely that occurs. A young child, for example, will tend to be quite anxious. They may have some regressive symptoms, meaning they start to suck their thumb again. They maybe start to wet the bed again. They have trouble in their ability to separate from their parent. They may have nightmares. They may also begin to play out what happened during the traumatic event over and over again using dolls or draw pictures about it.
Sure, and then moving into elementary school, actually there's many similarities between a younger child and a child in elementary school. There's some research that suggests that elementary school children are less prone to flashbacks, but that's difficult to say. In any event, though, what we do see, though, as Dr. Lowenstein mentioned, even in elementary school, is that this traumatic incident will be played out in the child's play, their behavior, their drawings, and we'll be talking in the next segment about how therapists can work with a child and help parents to work with a child, intervening in their play to help them resolve the crisis.
All right.
And the adolescents tend to resemble adults in their response to trauma.
So closer to adults.
Closer to adults,
to a child.
yes.
All right. We're going to take a short break. We'll be back with more with our doctors right after this. You're watching Community Psychiatric Centers Presents on PCNC.
Have you noticed something different about your child lately? Does your child seem withdrawn, unhappy, depressed, or prone to sudden outbursts? Your child may be suffering from a mood disorder, and it may be time to get help. At Community Psychiatric Centers, Dr. Robert Lowenstein and Dr. John Carasso lead a highly trained professional staff that offers mental health diagnosis, treatment, and therapy to children and adolescents. Call 1-877-899-6500 today for a free phone consultation.
At 5 o'clock, you can depend on us.
To cover news that happens in the area where you live.
Because local news is what we do at Channel 11 News.
Every day, our reporters and photographers are in local neighborhoods.
I'm in Aliquippa.
In Greensburg.
We are here in the city of Butler covering important local stories.
Reporting live from Bell Vernon.
Reporting all the facts.
Just got off the phone with Homestead Police.
I'm David Johnson.
And I'm Peggy Finnegan. If local news is what you want at 5 o'clock.
Count on Channel 11 News at 5.
Welcome back to Community Psychiatric Centers Presents. We're talking with Dr. Robert Lowenstein and Dr. John Carasso of Community Psychiatric Centers about post-traumatic stress disorder tonight. And Dr. Carasso, what can a parent do to help if their child has experienced a trauma and is having trouble coping?
Great question. And actually, there are a multitude of things a parent can and needs to be doing with their child who's experienced something like that. Actually, too many even to discuss in full length in this program. Which is why it's so important for a parent to call and get a consultation, come in and talk about this, because there's so much that needs to be happening. But one of the most important things is that the parent needs to maintain and monitor their own composure, their demeanor throughout this whole process and the aftermath of a trauma, which can be especially difficult if the parent has also experienced the trauma, but is vitally important. The child is depending upon the parent to keep their composure and maintain their emotions. If the child senses that the parent is falling apart, so to speak, then it's going to be much, much harder for them to keep it together themselves. And so the parent needs to communicate reassurance, both in their demeanor, their words, their behavior, hugs and affection, vitally important. The child needs to not just hear reassurance in the parent's words, but also to experience it in closeness and in affection and in hugs. Maintain consistency in routine. Predictability is vitally important. Maintain consistency in discipline as well. It's important not to let the roles lapse. And limit exposure to television, especially news media, especially if it's a hurricane type of situation. Many things that can and need to be happening that are vital to help the child to recover.
Dr. Lowenstein, what about professional treatment and medication? What kind of options are there?
Sure. Really a combination of the use of medication and also psychosocial interventions are the best to be used in the treatment of PTSD. Also should know that there also are other conditions that are associated and go along with PTSD, such as depression and anxiety itself. The types of medications which are generally used in the treatment of this condition are the antidepressants. There's two that are currently FDA approved for the treatment of PTSD. One is Zoloft and the other one is Paxil. But there are other antidepressant medications which are quite effective in the treatment of this condition. In addition, sometimes we treat people with anti-anxiety medications in order to reduce the anxiety that the person is feeling for a short period of time because of the addictive potential. In addition to that, there's some studies being done now, very interestingly, by the NIMH, where cycloserine, which is a chemical which helps to extinct the feelings of fear in people, is being tested and seeing whether or not that can help to reduce the degree of fearfulness and anxiety, as well as there are some beta blockers which are being used, for treatment of high blood pressure, which also can help reduce the degree of anxiety. In addition to medications, of course, the psychosocial interventions are very helpful. Cognitive behavioral therapy would be one of them, and another would be treatment with prolonged exposure therapy, which is a form of cognitive therapy in which the person is gradually helped to re-experience the event in a safe environment and to reduce their response to it.
Dr. Crasso, what about psychotherapy?
Sure. As Dr. Lindsay mentioned, the two primary components that we use as community psychiatric would be cognitive behavioral therapy, as well as a form of that CBT with a play focus as well. And as Dr. Lindsay mentioned, the focus is on exposing the child or the adolescent to the feared stimuli, which in this case is their thoughts. You have to keep in mind that when the child experiences their thoughts with a recollection of the incident, it's extraordinarily anxiety-provoking, induces anxieties and fears. So what we do is help them to think about the trauma, but in a slow, progressive way, combined with relaxation techniques and coping strategies, so that they're able to ultimately think about the trauma without being overwhelmed by it. And when they get to that point, many of the trauma symptoms can subside. With the play, not uncommon, especially in younger children, the play can be stereotyped and regimented in the sense that they act out the trauma sequence in the play over and over and over again. And so what we can do, and we can teach parents this as well, is to intervene in the play so the child can move beyond the trauma in the play to more productive and healthy resolutions in the play sequence, as opposed to getting stuck at the car accident. That's where the play ends.
Do you have to do this over a long period of time when you talk about, letting them re-experience some of this in a safe setting?
Well, keeping in mind that these thoughts and feelings are overwhelming, and so it's vitally important that we use a slow pace and we monitor the child very carefully to make sure they're not being overwhelmed by their own thoughts.
However, this is a very treatable condition, and it does improve within 3 to 6 months with treatment, and so that it's not a long-term process generally. Now, there are exceptions to the rule, but generally it's very highly treatable in a relatively short period of time.
It also depends on how long the trauma's been going on for. I mean, long-term chronic abuse of some sort, obviously longer to treat than a one-time incident of a car accident, for example.
And whether or not they have any other conditions associated with this.
Exactly.
Do some children and adolescents have more of a difficulty coping than others with traumatic events?
Well, that really depends on the individual child. If the child has been exposed to trauma over a long period of time, that would make a difference. If they have other issues, long-standing issues in the family, chronic, chaotic home situations, child abuse, child neglect issues, other diagnoses, substance abuse, all those make the prognosis worse.
Two primary factors would be, one would be if the child has experienced past traumas. The more traumas a child's experienced in the past, the more susceptible they are to post-traumatic reactions. Also, the parent reaction, talked about that before. That's vitally important. If a parent can maintain themselves, it's a much stronger likelihood that the child will as well.
All right, let's take a quick email question. This is from one of our viewers who wrote on your website. Lately, my child has been appearing tense and has been worrying when I leave in the car to go shopping or wherever. Sometimes she even has tantrums. She seemed more irritable lately, and teachers say she's been having trouble concentrating. I can't figure it out, except that she witnessed a car accident. But that was about 6 months ago, and she has seemed fine until now. Do you think there is a connection?
There is a connection. There's a condition called the delayed onset of PTSD, which occurs usually after 6 months of the original trauma, which is unusual and not very often seen. But it can occur. We have a delayed response to a traumatic event. This sounds like it could be that, but the child would need to be evaluated fully in order to see really what's going on.
It's also referred to as a sleeper effect, where again it remains dormant for a period of time, and then who knows what could spark the trauma reaction 6 months later. But also keep in mind that this also speaks to the idea that we don't want to make assumptions about how a child should be responding or when they should be responding, in any given way or any given time. We need to deal with the child as they present with the symptoms and help them accordingly.
All right, we're going to take a short break. We'll be back with more questions for our doctors right after this. If you have a question you'd like to email, remember the web address, cpcwecare.com.
Every parent has sweet dreams for their baby, but what happens when the unexpected happens? When a child develops slowly, has trouble talking, or withdraws into a world all by himself? Today in America, an estimated 1 in every 150 children is diagnosed with autism. And while there is no known cause and no known cure, an early diagnosis can make a major difference in an autistic child's life. At Community Psychiatric Centers, Dr. John Carasso and Dr. Robert Lowenstein have more than 50 combined years of experience diagnosing and treating many thousands of children and adolescents with autism spectrum disorders. They, along with their highly trained professional and caring staff, can evaluate, diagnose, and treat children and adolescents who may be having problems at home, in the community, or at school. If you believe your child needs help, call 1-877-899-6500 for an evaluation at one of our 11 convenient locations in southwestern Pennsylvania. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
And welcome back to Community Psychiatric Centers Presents. We're talking with Dr. Robert Lowenstein and Dr. John Carasso of Community Psychiatric Centers about post-traumatic stress disorder tonight. And let's go right to another email question. Doctors, this is from one of your viewers. My husband and I are getting a divorce. Would this be considered traumatic for my child, and should I expect signs of PTSD?
Well, clearly a divorce or separation of parents is always emotionally traumatic. Whether or not it raises to the level of post-traumatic stress disorder depends upon whether or not the child has been exposed to domestic violence in the home, whether or not the child has been abused or neglected, whether or not, as part of the separation, the child has been frightened by observing events in the home which can be quite frightening to the child.
And so what can be expected is we'll see, it's not uncommon, we'll see a child regress. They may become more emotional, they may, bedwetting may reoccur, those types of things. And however, we don't typically then see post-traumatic stress disorder reactions in that sense. But again, it goes back again, I mentioned it as well, the parent reaction to this. If parents are maintaining themselves appropriately, how they deal with the child, how they deal with the spouse who's soon to be an ex-spouse, it's important that occurs, because that helps the child to deal with the whole incident and move beyond it in a more healthy manner.
How do children respond to natural disasters or man-made disasters such as shootings? I can remember in my news days I covered a story where there were some children involved in a plane crash and they survived that. On the way home, getting back to their home, they put them on a train. The train hit a child on a bike.
Oh my.
So, they had been doubly traumatized. How do children overcome something like that?
Well, obviously, that's very traumatic. To be witness to this kind of event, or this kind of double event, is very traumatic to children. And the way they get over it is basically to have an atmosphere of openness that they can begin to talk about what happened without being told they need to tough it out or they need to get through it on their own. They really need to have supportive systems around them that permit them to express their fears, to share the experiences together, and to gradually come to terms with it.
Sure, and responses are difficult to predict. Some children may cope quite well and others may not, and it's tough to say why that's the case for any given child. Again, though, an atmosphere of openness and expression of feelings, and being able to work with the child, possibly in therapy, to help them be able to experience their thoughts, possibly in regards to recalling the incident, without those thoughts being overwhelming. That's a key aspect of the treatment.
There are temperamental differences between people, and some people have a greater ability to withstand stress and trauma and others don't. It really depends upon their personality, their history, what's happened to them before.
Do you see many children who, they may experience one trauma and they kind of weather it well, but it's the second trauma, at a later date even, that really hits them?
Oh, absolutely. The more trauma somebody is exposed to, the harder it is to adjust to them.
Yes.
Is there a certain age when children are more likely to develop signs of PTSD?
Any age, really. Any age in which a child is exposed to something that gives them intense, extreme fear, horror, and in a situation where they fear or they see somebody getting harmed.
We had talked in a prior episode how a case can be made that children are even more susceptible to depressive episodes, anxiety reactions than adults are. They have less coping strategies, they have less life experience to pull from, and so children, especially under 11, are especially vulnerable. But as Dr. Lindsay mentioned, any age is vulnerable, and it speaks also as well to prior history, prior stressors and anxieties and traumas the child experienced that play a role as well, and parent reaction as well.
I think one of the big questions is, how long is PTSD likely to last? If a parent has a child who's suffering from this, is there any real timetable, or what do you predict?
According to the DSM-4, which is the Bible for diagnostic work, a person who experiences PTSD symptoms under 3 months of age is considered acute. Those symptoms have to be present at least 1 month. If a child or an adult experiences those symptoms beyond 3 months, it's considered chronic. Generally, these improve within 6 months to a year.
And again, though, we're not going to set specific time parameters for any given child. Symptoms can run from 3 months to 3 years, and we don't want to impose our expectations on the child, because that can be damaging.
Is there ever a case, or do you find many cases when you're dealing with an adolescent and you may not even see signs, or maybe the parent doesn't see the signs, but then the child starts having these other problems, and then they end up self-medicating?
Well, there's a much higher risk of substance abuse in teenagers who've been experiencing PTSD symptoms, much higher risk of suicide, depression, anxiety, and other conditions which may then emerge.
And it reflects the need for parents to closely monitor their teenager if the teenager has experienced a traumatic event, keeping in mind that even months later, certain behaviors can come to the surface that need to be addressed.
Do children ever or adolescents try to hide these symptoms because they don't understand what's happening?
Part of the psychoeducation Dr. Lindsay mentioned is teaching children and teenagers that certain reactions are expected and understandable, and not to be feared, and if they experience these things, to seek help, to seek an adult, because they can get help for these things and recover from them, as opposed to turning to self-medication.
Right. You can also ask a teenager to maybe start keeping a journal of their feelings, or write out what happened at the event, and go over that with them. It's very helpful.
All right, we'll take a short break. We'll be back with some final questions for our doctors right after this. You're watching Community Psychiatric Centers Presents on PCNC.
As a parent, you want your child to reach his or her full potential. For children with autism, early detection and treatment can make a world of difference in your child's life. At Community Psychiatric Centers, our autism unit is led by two highly trained and experienced mental health professionals, Dr. Robert Lowenstein and Dr. John Carasso. Their expertise in the field of autism spectrum disorders means you and your child will get individualized help you need every step of the way. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
The 11 at 11 format is unique in the Pittsburgh market.
11 o'clock at night, 11 minutes on Channel 11.
David and I work very hard to make sure that we deliver to you the news that you need in the first 11 minutes. We also give you weather.
And everybody is affected by the weather. I'm going to prepare people for the next morning.
The important information you need to know to plan your day, weather-wise.
We know it's late, we know you're tired, we know you're busy. You want all the important information as quickly as you can get it. That's what 11 at 11 is for.
Welcome back to Community Psychiatric Centers Presents. Let's go right to an email question from a viewer. A woman writes, I've been diagnosed with PTSD and have struggled with symptoms for most of my life. Does that mean my child has more of a chance of also getting PTSD? Very interesting.
It is interesting, and the answer is not sure that she actually has PTSD, being that it's lasted all of her life. We would need to have her evaluated to see what her condition is. Chances are she has some form of anxiety disorder, though, as PTSD is an anxiety condition, and that certainly can be transmitted to a child.
In the sense that, especially in the sense that, if the parent's typical response to anxiety situations and stressful situations is to become overwhelmed and panicky, the child picks up on that, and they may behave in the same manner. That's why it's so important for parents to maintain self-control.
What kind of services does Community Psychiatric Centers offer for traumatized children, particularly if they're having some trouble in school?
The important thing is to begin treatment very quickly, soon after the trauma occurred. Very important to get in there, begin to give the child an opportunity to express their feelings and talk about what they experienced during the traumatic event, and then begin treatment immediately. Treatment can include outpatient wraparound services as well as the use of medications.
Yeah, outpatient counseling, medication management, the wraparound services can be helpful because they can take a child into the community. And sometimes if they have phobic responses to the community, that can be very helpful to have a therapist there with them.
All right, doctors, as always, thank you for being with us, and thank you for watching. Don't forget, if you have any questions, you can log on to the website, cpcwecare.com. Thanks for being with us. We'll see you next week.
I've been at the station a long time. I've covered a lot of important stories, and I know you want an experienced news team that's been there, covered all the angles.
Live coverage.
The news is important, but what's really important is how it affects you, how it affects me.
Local news.
Many of the stories that we tell affect people's lives, and it's our job to deliver the news that you need day in and day out.
Local news is what we're all about. That's all we do, really. Local news.